Many personal circumstances have changed, and all of this can lead to anxiety and even fear. So, how do we handle this? How do we get through to the end that we know will be here eventually? But in that meantime, how do we adjust? So, for answers, we turn to Dr. Farhan Jawed, psychiatrist and chief of staff for Norman Regional Health System. Dr. Javed, thanks for taking the time to update us today.
Thank you, Mayor Clark, for having me. Well, first of all, I would like to thank you for having these live Facebook events. And today's event is very important about the psychological health of the people. And I'm sure by the end of this day, we'll be able to alleviate some of the anxiety that our public is having. So it is true that these are unprecedented times. Life is not the way it used to. And we are getting used to this new normal that was never the normal for us. And whenever that happens, it creates a sense of insecurity, it creates some uncertainty, and that creates fear. And the fear always produces an emotional response in our body that can lead to different psychiatric, psychological issues, including depression, anxiety, and sometimes affect people adversely, emotionally. Depending upon the nature of the stress, individuals' coping skills, the support that they have available, some people cope better with others. Luckily, and it's a pleasant surprise for me that so far a community of individuals and patients who are struggling with mental health issues are actually doing very well these days. And I must say that they are making some really good choices. They are trying to stay out of the hospitals. They have been reaching out to us in our clinics and our inpatient unit, asking us questions about how to keep themselves safe at home. And I must say at this time that the silver lining here and the best decision that we could have made was this shelter in place order that you instituted. And that has helped us a lot in this situation because we see that people are staying at homes, they're keeping themselves away from the spread. And that is helping us on the medical side as a facility as well. Because if we had not done that, there was a fear that we would have an overwhelming surge of patients coming to the hospital that would make the system more overwhelmingly crowded, and that could have affect healthcare providers as well. So this initiative is not only helping people outside of here, but it's helping us as well. I have been in touch with our ER staff, our director of the ER, and they have informed us that at this time we have a steady flow of people coming, and we've been able to take care of them. People are being responsible. Those who have dire needs are coming to the ER, and mostly people are staying at homes. So this way, we are able to take care of the patients who have their acute needs. We have the adequate supplies, staff, place. We are treating them and helping them. So I think this is an amazing collaborative effort by the community leaders, ourselves, and it's working very well. And we are very hopeful that in these next coming few weeks that we are sensitive about, we'll be able to slow down this surge and hopefully flatten this curve if we keep on doing what we are doing.
Awesome. No, I appreciate your support on that. And I love that you pointed out we didn't do the stay-at-home order just to protect residents. We did it to protect our healthcare system because people are still having babies. People are still having heart attacks. We still need our hospitals to function properly while handling the increase of COVID-19 cases that can lead to hospitalization. So, Dr. Javed, we touched on how this situation is unprecedented. What can we expect to see over the next few weeks as isolation continues?
Well, our hope is that if we keep on following the guidelines and the isolation protocols, we can limit the spread of the infection. And that is our only chance and hope so that we can protect everyone. Right now, as I mentioned earlier, the flow of patients is pretty smooth and steady. We are not seeing any intense increase in the amount of patients coming. So as long as the people stay at home, follow a healthy physical and hand washing hygienes, social distancing, it's going to help all of us.
And so that will help on the physical side, and we because we know that viruses are contagious, but emotions can be too. So how do you avoid getting infected by someone in terms of negativity that's running rampant right now? And what can people do to stay emotionally healthy during this crisis?
It is true, and it is pretty obvious that anytime you have these sort of circumstances where there is a lot of uncertainty and there's a lot of fear, people can become a little more anxious, and that can give rise to some negativity. I usually tell people that the issue here is that we are used to a controlled environment. And right now, we don't have the control over our environment. And that is why we can have fear that can lead to this sort of negativity. So, what I usually tell people is try to focus on the positives in life. We can either look at things or glass half empty or half full. As a social situation, when these things were not going on, one of our main complaints was always that we don't get enough time to spend with our families at home for ourselves. And now, with this situation, which is kind of a negative situation, we can make it positive by looking at the good things. Right now, we have the ability where people are working from homes, children are at home, so you can spend more time with your families and be mentally satisfied that they're all secure in one place. So you can use that same negativity and turn it into a positive thing, and we can look at the glass half full rather half empty.
I like that. For my full time job, I actually run a leadership program at the University of Oklahoma. And I know many of my students are bummed that the semester ended the way it did, especially our student athletes. But I also know their parents are quite thrilled to have them home, especially before they, leave the nest for good and take on their full time responsibilities. So I love that you mentioned that. There is a lot of opportunity for good quality family time right now, but it can still be hard. So are therapists and psychiatrists such as yourself doing virtual visits right now?
That is true. Actually, for this time, this is usually a best practice to visit a patient through a virtual visit. Nowadays, with our newer iPhones, Androids, tablets, we have the ability to communicate with people through telehealth. Here at Norman Regional, we have televisits that we can help patients with. I know that almost all of the psychiatrists and psychologists that I know in the area are using different applications to communicate with patients through tele apps. We in my clinic are using HIPAA compliant tele applications so that we can see the patients. And it's actually helpful to us because in our practice as psychiatrists, we don't have to do physical examinations. So the patient doesn't have to be present in the clinic for us to see them. Now, I'm pretty old school. I always like to see patients face to face. But I was actually amazed that by seeing a patient through a video link can be as valuable. And you can see how they're acting, their emotions, and you can talk to them. And I can give you a good feedback that all of my patients, they have been so happy that they don't have to get out of the house. They can stay at their homes and speak with us. We can evaluate them, send their medicines to the pharmacies. So overall, it has been a very good experience. And I would recommend everyone who's listening that if you feel you have a need, you should reach out to your providers.
Now, a question about that, and hopefully we can post some resources in the comments. Same thing with the physical health. I get concerns from residents that don't have insurance or are scared of losing insurance because of the change in employment that may or may not be coming up. So hopefully one of us can post some resources, even if it's just a hotline people can call to talk to. Because I think what I recommend from my own personal experience is don't be afraid to ask for help. You may not need to jump straight to finding a psychiatrist, but I've reached out to all of my best friends who are struggling with worrying about where the money is going to come from. Now, suddenly taking care of kids and teaching at home, and just said, reach out if you need a hug, a virtual hug, or a word of encouragement, because we are all in this together. But the first step is not being afraid to ask for help.
Well,
Go ahead.
I'm glad you brought up that question of not having the insurance or the means. We are lucky in Norman that we have Central Oklahoma Community Mental Health Outpatient Clinic here. So if we have someone who cannot get access to their physicians because of some financial or insurance needs, then those facilities are free for the individuals who don't have financial means. So you can get a psychiatrist, psychologist, you can get appointments and medicines through them. So I would recommend that if people need help, they can call Central Oklahoma Community Mental Health Clinics.
Oh, thank you for sharing that, doctor. I appreciate that. I wasn't unaware of how far that resource went. But to pivot a little bit, this is hard for adults, obviously, especially as we're worrying about money and the future and all of that. But it's also really hard for kids because it's hard for them to understand what's going on. I'm sure, like my kindergartner is thinking, "Wow, I just have a really long summer and I get to play board games with my parents a whole lot more." But my seventh grader, not so much. He can tell something's going on, but not quite sure what it is. And this can often lead to emotional problems for them as well. So, do you have any advice for parents on how they can handle anxiety within their children?
Yeah, that's a very good question. Thank you for asking that. Actually, I have three little kids as well. So, first of all, I want people to know that our kids are much smarter than we think they are. So they can read us very well, and it has to start from the parent's side. If a child looks at you and you look as if you are anxious, angry, irritable, frustrated, shaky, nervous, jittery, if you have those signs, the children will automatically get anxious. So the children always mirror their families and their parents, especially. So, but if you are calm, collected, relaxed, you will see that your children will be also relaxed. However, speaking with children is a little different issue. Depending upon their age group and their level of maturity, we talk to them differently. For example, your preschoolers and primary schoolers, you don't have to worry about them much. But the group I am a little concerned about is the elementary group, because these children are old enough to understand that there is something wrong going on, but they don't totally understand the magnitude and severity of the issue and how to deal with that. And you don't want to overwhelm them by giving them too much information either. So for those parents, I would say the children fear is that something is going to happen to their parents or them mostly. So you let them know that this is just an illness, just like a flu or a strep throat, and like you get to take some time off from school and you don't share your toys and you don't touch different things. So that is what you are doing right now, and this will be all over. So you have to keep it in that sort of a detail so that depending upon their mind and their level of understanding, they can understand that and they should be fine with that. Now, the next group is your middle schoolers. Now, that is a bit challenging because these kids are old enough and smart enough to understand the situation. They know the consequences and what bad things can come out of it, but they have not necessarily developed the coping skills to deal with all of these.
Mm.
So, for those younger middle schoolers, I would recommend the parents to be very open and honest with them. Keep the channels of communication open. Let them know what you know and discuss with them what their fears are. And then that will help them a lot because they will have someone to talk to whenever they feel fearful. Now, the fourth group is what I'm a little concerned as well. Are high schoolers. They are old enough, they're mature, they probably know a lot of things that we don't. However, they can be a little carefree or careless. So we want to make sure that they stay at home and don't go out and hang out among their friends and have this social distancing process going on. So again, depending upon their age group and their level of maturity, we have to speak with them, and we ourselves have to keep ourselves calm so that they can remain calm.
Mm. And you went a different direction with the high school students than I would have. I know many are upset about their again seasons being canceled, graduation, prom. I know that SATs and ACTs have been rescheduled, and so just I think anxiety with college or even the college students. I graduated from law school in 2008 when the economy tanked, and I was nervous about a job. And I can't help but think that I bet some of our college students who are getting ready to graduate are having the exact same thought. So again, don't be afraid to ask for help if anyone needs it. And I love your advice on the different age groups. But to kind of pivot from the children, you are medical director of the Senior Counseling Center, and we know that seniors are particularly vulnerable to COVID-19 and also depression from isolation. So how do we help our parents and grandparents right now?
That is very true. We want to protect our seniors. And the issue here is that while we are doing social distancing, we don't cause social isolation. So, depending upon where our seniors are staying, there are some older adults who are staying in nursing home or assisted living facilities. those are cared for because there are staff available for them. But those who are living in independent facilities or independent homes, depending upon their level of strength and functioning, we as families have to step in. I will give you examples of my own patients where one of the children have taken upon themselves and make their responsibility that they will get all the groceries and medicines for their parents and bring them to their home. And if they have any other chores or needs, they will do it for them. And then there are few who are so careful that they would bring all the stuff and put it at their doorstep and won't even go in because they don't want the parents to get exposed to anything. So this is the time where these elderly family members need the support of their children, their family members, and that is the best thing we can do. We keep in touch. If we are fearful about them getting exposed, we have to prevent them from going out, and we can actually be there for them to provide what they need.
Now, you may not have the answer to this, but I'm going to ask it because my family really believes in letters and cards. My oldest is a wonderful little artist, and so we've been mailing little greetings to our my grandparents. My kids are lucky enough to have great grandparents, and so. Does the virus live on letters? Is that something that, we should say, hey, we're mailing you something, but don't open it for 3 days, or any advice you have on that?
Yes, sir. What I have learned from our infectious disease specialist that if you don't have any symptoms and you have not had any exposure to anyone and you are physically healthy, then the chances of you transmitting anything on a letter would be very, very remote. We obviously don't know where it has been handled. So the more careful you are, the better it is.
Okay, so glad to hear that. My grandma is excited to hear that too.
But I
So
would
finally,
Yeah,
oh, go
but I
ahead.
will tell you one more thing that I am very impressed with. That while I've been doing these televisits, some of my senior patients, as old as in their mid 80s, are so good at using cameras and iPhones that I am surprised and I'm actually happy. So I guess that would be one way of communicating with them as well.
But definitely, definitely. Very good point. Very good point. Finally, what about our frontline healthcare workers who are face to face with this virus every day? I mean, there's got to be anxiety associated with that. What are we doing to help them manage their emotional health as they're, doing everything they can to save lives, but also living with the fear of contracting COVID-19 themselves?
Well, I will tell you from my personal experience that first, being the chief of staff of this hospital, I'm extremely proud of all of our physicians, nurses, and all the group of engineers and other ancillary staff who are working with us. These guys are working tirelessly throughout the days and nights and putting themselves on the line. So no matter how much we thank them, it's not enough. And all of these are very resilient, selfless kind of people, and they know the kind of job that they do. However, these are troubling times. There is some anxiety, and due to the nature of this illness, sometimes all of us can become a little anxious and a little fearful. So, this is what I have been telling all of my staff, and I told my nurses as well that when you come prepared for your work, you make sure that you follow the same routine that you do. You are coming to work, you should be mentally prepared. You follow your routines, you follow the isolation and safety protocols, and trust the system. Here at Norman Regional, our emergence infectious disease team, our infectious disease physicians, our other physicians, we are working very diligently to create a system, and we already have where we have all the protections available for our staff who are working. We are collaborating with the CDC, Health Department, other hospitals and university in the Oklahoma City area. So all of us have similar efforts and similar message with regards to the protection that we are providing. As long as you follow all the rules, regulations, procedures, you should be safe. So we need to trust in ourselves, trust in our system. And then at work, you have your second family. You spend half of your day, actually sometimes 8, 9, 10, 12 hours at work. So this is your second family that you can rely on. You can lean on them, talk to your fellow nurses, your supervisors, doctors, and share how you are feeling. So we will do our best to support each other. I truly believe that, like any other bad event, this shall pass too. As long as we are standing together, we are staying strong, we work hard, we work smart, we keep on moving forward and never look back, and we should be fine.
That's right. We will get through this. It is a matter of time, and I will take this opportunity to say the stay-at-home order and social distancing measures, the sooner we all follow that, the sooner we get to the end of this thing. So, Dr. Javed, this has all been great information. I really appreciate you. Excuse me. Sorry about that. I really appreciate you taking the time to connect with me because we need to be talking about mental health as we're all social distancing. Luckily, technology has created a world where I think we're better equipped to handle this. But it's still really important to know the resources out there and to know that we're talking about it as well. So I want to thank you for your time today. I want to thank you, everyone watching. Please go ahead and share this video so it reaches more people in your circle of friends and loved ones. And don't be afraid to reach out and call someone and just check on them, especially if you know that they've had a rough time. We are all in this together. So thank you so much for your time again, Dr. Javed. Be safe, everyone.